think it's an excellent question, and I think that the trial is it's a really important trial, which is starting to further change the paradigm in a very high risk patient population. That being this trial specifically, the SunRISe-1 trial, cohort 2, being the patient who has carcinoma in situ that's BCG refractory with or without papillary disease. This was a trial design which looked at just over 80 patients who kind of fit the appropriate definitions, were either ineligible or refused cystectomy. And the design was such that they had a TAR-200 device placed every 3 weeks for the first 24 weeks of treatment, and then every 12 weeks thereafter, for the duration of the trial. Primary outcome of the trial itself was a complete response, anytime complete response, and they looked at some important secondary endpoints, including things like duration of response, overall survival, cystectomy-free rates, amongst others. So what we look at and what we see again, now this is and I think it bears to mention the fact that when we look at complete response, this was a biopsy mandated on trial assessment of complete response, so not just a visual assessment. So they kind of went above and beyond, and I think that's important. So these CRs really are, I think, in fact, CRs when we consider this data based on the biopsy requirement on trial. And secondarily, this is a high-risk patient population, right? And in whom limited therapy options exist, even with novel approaches, recently FDA approved in the marketplace, and for which radical cystectomy is the current, at least one of the current standards of care. But we know that most folks would like to avoid cystectomy if possible, and even those folks who are eligible for it, a very small percentage actually choose to go through radical cystectomy for this disease state management. With that background being said, the rates of complete response were above 82%, anytime complete responder in this group of folks, and the durability, which I think is really what is a paradigm change here, is the durability of response. Is about 52.9% of these patients maintain their complete response, greater than a year to 12 months or more, which really changes the landscape of this disease state. So now we're not just seeing patients in whom we're having an initial complete response at 3 months, but yet we are reconsidering cystectomy at 6 and 9 months of follow-up based on recurrent disease. In those patients who respond, those patients tend to respond quickly. And the durability of response is really impressive, and it stacks up, I think, very competitively against the landscape of other products currently in the marketplace. Currently, we can't obviously cross trial compare. However, when we see the outcomes in the context of tolerability, which was excellent on trial, certainly gives us some confidence that this is a paradigm changing therapeutic for patients with BCG refractory carcinoma in situ with without papillary components.